up in the February episode of Hometown Health, it's Heart Health Month. We'll tell you what steps you can take to keep your ticker in tip-top shape.
Also, we'll tell you how the specialists at Tri-County Podiatry spot the signs of a heart problem just by looking at your feet.
Plus, another connection to heart health that affects your well-being elsewhere in the body, why you should tell your dentist if you have heart disease. Welcome once again to the multi-award-winning Hometown Health. Good things for those who wait. I'm Mark Roberts.
And I'm Beverly Onstead in studio at Lake Sumter State College.
February is Heart Health Month. Cardiovascular disease is the #1 source of death here in the United States, accounting for 1 in 3 deaths each year. According to the Centers for Disease Control and Prevention, African American men, particularly in southeastern states, are at the highest risk of developing heart disease. A reported 40% of African American men have high blood pressure, a contributing factor to heart disease and stroke. Heart disease is also a leading high-risk condition for Hispanics and whites, while ranking lower on the list for Asians, Native Americans, and Pacific Islanders. But there are ways to stack the deck in your favor. Regular exercise can strengthen the heart, even something as casual as a 15-minute walk 3 times a week. A heart-healthy diet goes a long way. Fruits, vegetables, and lean meats will keep those arteries clean. If you're a smoker, quitting will reduce your chances of heart disease dramatically as well. But even if you do everything right, you should still get regular exams with the doctor. Dr. Fred Wittenstein of Florida Hospital Waterman's Center for Medical Imaging tells us about the breakthroughs in cardiology evaluations.
CT scanning's become a go-to for cardiology evaluation, especially in patients that the type of problem they're having is questionable. If you're not sure if it's a cardiac issue, rather than waiting 24 or 48 hours for blood tests to come back or taking them to the cath lab, which is a more invasive test, we can screen them with a CT scanner now and get an answer in a matter of minutes to an hour, as opposed to waiting 2 days. We think of CT scanners in terms of slices. So a CT scanner was 1 slice, and then it doubled to 2, and so on, 16, 32. Our fastest, biggest CT scanner right now is 64 slice, and this one's the equivalent of 128 slices. And so it has a much wider range that it can scan a patient at one time, and it can freeze things that are moving. So we can freeze a beating heart now. It just allows for better, quicker, and safer diagnosis, more accurate diagnosis. The more you can see, the more you can manipulate the images, the better the diagnosis you can get for the patient. Faster is better for a lot of reasons. First of all, when we can do them quicker, we don't get motion artifact. The patients who are usually in pain don't have to be in a scanner a long time. In general, in medical imaging, faster is always better. Overall, this machine is a good choice for our patient population because we can scan people quicker, which is more acceptable to them. They can tolerate it better. We can use lower dose, which is safer for everyone, especially the pediatric patients and the patients that need repetitive scans. One of our largest customers in the hospital is our emergency room, and it's a very busy emergency room, and we get a fair amount of trauma patients coming in. And trauma patients, especially if they're unconscious and they can't tell you where it hurts, need to be scanned almost from head to toe. And so we can put a patient in the scanner and scan the head, neck, chest, abdomen, pelvis very quickly, process the images very fast, and get them to the radiologist to diagnose what's going on. Patients that need to have scans repeatedly, such as oncology patients or patients that have chronic diseases or multiple kidney stones, are much better off with this kind of scanner because it's a lower dose. And so radiation doses can be cumulative, so the more you get over time, the more potential issues you could have. And so by keeping the dose as low as possible and still get a good diagnosis, it's much safer for the patient.
For more information on the board-certified radiologist at the Center for Medical Imaging, or to find out more about their numerous imaging procedures, please click the Imaging the Heart story link icon on our homepage at yourhometownhealth.com.
The heart is one of the most vital organs we have. The blood it pumps is essential to every inch of the body it reaches. But what happens if that blood doesn't reach its destination? Poor circulation is often caused by the buildup of plaque inside the blood vessels and capillaries. The symptoms can start off with a little discomfort, but if left unchecked, could escalate to organ damage, strokes, and hypertension, not to mention high blood pressure, which circles back to heart disease. Symptoms of poor circulation to watch out for are cold feet or hands, numbness, exhaustion, dizzy spells, headaches, loss of memory, skin blemishes, or swelling in the feet. If your feet are exhibiting symptoms of poor circulation, seeing a specialist can help. Dr. Felix Essery of Tri-County Podiatry explains the importance of getting an exam.
Circulation is key in foot health. I mean, we see a lot of bad things as far as lack of circulation leading to gangrene. It's usually later in life. But we do see it, with smoking. We see young people, 40s, having issues with amputations and lack of circulation. The obesity, it's just like your heart. If your heart's affected by circulation, the same things happen in your arteries and your legs. So all the lipid profiles and cholesterol and all that, it's bad on your arteries and your heart. It's doing the exact same things to the arteries in your legs. And that's become a real emphasis in recent years. Being proactive on that, we check everybody for circulation. And a lot of the people don't even come and complain of circulation problems, but we find it on examination. And then when you dig deeper, they'll tell you they're not active because when they walk, they get a severe cramp, so they just don't walk. And that's when we're able to get them into a cardiologist or interventional radiologist to have them examined more thoroughly, and possible intervention. They can do catheterizations and stents on the legs now.
I had a callus on the bottom of my right foot. It wouldn't heal. It was there, I'd say, about 3 months, and it was very difficult to walk on it because it would hurt. And I went to a few other doctors around here, and they did various things, but nothing helped it. And I got the callus pads naturally, and nothing helped that. So I came to see Dr. Wu, and Dr. Wu took a look at it. He felt my legs, and there was no circulation. He couldn't get any circulation in my legs. So he immediately set up a test in the image center. And I went over there and they tested me. They tested for blood flow in my legs. And they found out that I had no blood flow at all. So immediately that evening, Dr. Wu called me up and told me I better get a hold of my cardiologist because I have no pressure in my legs. And what's gonna happen is I better do it right away because it's gonna hurt and it's gonna be a lot of pain. I didn't feel anything. There was no numbness, no anything other than the callus. There was no other signs that I had no circulation in the legs. So that was really a critical diagnosis. Anytime I have an opportunity to recommend Dr. Wu, I do, because I think he's great.
You'll find information for Tri-County Podiatry when you click the Go With The Flow story link icon on yourhometownhealth.com.
Would you tell your eye doctor that you have a toothache? Probably not, but you should tell your dentist if you have a heart condition. The American Association of Periodontology states that oral health and heart disease are connected by the bloodstream. The blood carries bacteria from the mouth to the heart, where the bacteria can latch onto any damaged area and cause inflammation. Contracting gum disease increases the risk of harmful bacteria forming in the mouth. This can result in conditions such as endocarditis, where the inner lining of the heart becomes infected. Gum conditions such as gingivitis can greatly increase the risk of bacteria infecting the bloodstream. Signs of gum disease are swollen or sore gums, bleeding gums, signs of infection around the teeth, or persistent bad breath. The specialist at Heritage Dental explained why you should inform your dentist if you have any history of heart disease.
If you're coming in and you have a history of heart disease or any kind of heart treatment, it's wise to mention that to your dentist and hygienist, and it should be part of your medical record. So we can make a determination if we need to clear the treatment through the cardiologist or not, and what precautions to take and what we should do and shouldn't do. So sometimes if it's a very serious case, patient's fragile, don't go off to the old surgeon and have the treatment. You have to know when to do that. You can't know that if you don't have the data, if you don't have the information.
However, when a patient comes in for an appointment, we do a complete oral exam We do the periodontal screening, so some patients might be different. They may need a more frequent cleaning, whether it's their buildup of the plaque and the bacteria, whether it's their overall systemic health, if they have other conditions like diabetes and heart conditions, they might need a more frequent cleaning like every 3 or 4 months. So every patient is different, and that's usually established at their first visit with us, but at least every 6 months. It's very important because there's a huge correlation between what's going on in your mouth and what's going on systemically throughout the rest of the body. I mean, there's good bacteria in the mouth and then there's bad bacteria. So if that bacteria is creating an infection in your mouth, it is going to go within the bloodstream to the rest of the body. I mean, over 600,000 patients have some type of heart disease. So if we can prevent any type of infection, that's kind of our goal. So it's very important to inform the dentist and the clinician of any health concerns.
The fact that they're already in the office tells me that they are already somewhat cognizant of that situation. But I find that our patients are much smarter about their oral health care now. They're more educated than our parents were. So they understand the correlation between dental health, gingival health, and diabetes, medications, their overall health. People understand that. Or now, granted, there's times I have to reinforce that and explain that, and the hygienist and my staff do that on a routine basis. But that connection between oral health and general health is pretty well established. One needs to have a dental examination first to make that determination. You might have excellent oral health care, and perhaps once a year is adequate. On the other hand, you may have a dental condition you're not even aware of, and until the dentist and the hygienist do a thorough examination, you really can't make that determination. Now, we're typically twice a year, and on average, for most people, that's fine. Could be more, could be less.
In addition, February is National Children's Dental Health Month. Most American children don't see their family dentist until they're well over 2 years old, far later than is recommended by both dental and medical professionals. Most parents postpone that first visit by saying their child's too young, doesn't have enough teeth yet, or that they don't have the needed insurance. According to the American Academy of Pediatric Dentistry, it's very important to keep baby teeth in place until they're lost naturally. The primary teeth are important for many reasons. Those baby teeth are involved in speech development, save space for permanent teeth, and promote a healthy smile that boosts a child's self-esteem. While likely to refer pediatric patients to other local specialists, Heritage Dental has some recommendations on how to ease your child into the dentist chair.
You should start to bring kids to the dentist probably starting at about 2. They're already consuming normal people food, and there may not be a lot, if any, dexterity in terms of how to brush and so forth. There may be some abnormal growth patterns going on. There's a number of different things that need to be checked. Tooth formation with x-rays, because you can't see in the jaw without doing that. So it's a good age to start to bring the kids in. And the way you want to do it is non-traumatically. What we don't want to have is a youngster of a couple of years old that's got a mouthful of cavities and toothache coming in and now having to have shots and all that nasty stuff that kids don't like. So a lot of times the parent will bring them in when they have their own appointment. You know, sit on the lap, go for a ride in a chair, see the dental stuff in a non-traumatic frame of mind so that when they do come in for their own appointment, it's not scary. You don't want to bring them in first appointment and scare them. Makes sense.
Start them early. You know, bring them in with your appointment. You know, let them see that it's not painful, that it's not a scary thing to go to the dentist. You know, encourage them at home to brush, to floss, get them in those habits really early. You know, and I'm a parent, so I understand it's really hard sometimes to make sure that your child is brushing. So create the routine with them. When you brush, you bring them in the bathroom with you and have them brush with you. So it's just creating that routine early, I think, helps a lot with children.
You'll find information for the services provided at Heritage Dental when you click the Heart of Dental Health StoryLink icon on our homepage, yourhometownhealth.com.
For our next story, we take you across the pond. It's been said that men and women see things differently, but now psychologists say it's not just a saying, it's a fact. Researchers at London's Queen Mary University School of Biological and Chemical Sciences used an eye tracking device on nearly 500 participants over a 5-week period to monitor and judge how much eye contact they felt comfortable with while looking at a face on a computer screen. They found that women looked more at the left side of faces and had a strong left eye bias, but they also explored the face much more than men. The team observed that it was possible to tell the gender of the participant based on the scanning pattern of how they looked at the face with nearly 80% accuracy. Given the very large sample size, the researchers suggest this is not due to chance. The participants were asked to judge how comfortable they were with the amount of eye contact they made with an actor in a video chat scenario. Each participant saw the same actor during the testing period, which was around 15 minutes. At the end of the session, the researchers collected personality information about the participants through questionnaires. With the norms of eye contact established, it provides a jumping-off point to determine abnormal eye contact habits, which are a common indicator of those with autism. The researchers plan to use these recorded consistencies in visual interaction to more effectively diagnose autism in both men and women. For the full findings, you'll find a link to the study at Seeing Eye to Eye when you click the News of Note tab on our homepage, yourhometownhealth.com.
Check your pulse. It's time for some heart-pounding, newsworthy numbers. "47%, the amount of cardiac-related deaths that occur somewhere other than a hospital, often because people don't recognize or respond to the warning signs of a heart attack quickly enough.
27%, that's the amount of people that are able to recognize all the major symptoms of a heart attack. 92% were able to name chest pain, but that's only one sign. If you're experiencing not only chest pain, but nausea, shortness of breath, dizziness, or a cold sweat, call 911 right away.
100,000 times. That's the average amount of times the heart beats each day. That amounts to 2.5 billion beats in the average lifetime.
Well, it's time to head for a break, but when we come back, that bright Florida sun is enough to make anyone squint. But are your eyes at half-mast all the time? There's an op for that.
Plus, controversial cholesterol. We know its ill effects, but our bodies actually need it. How much is too much?
And Dr. Charlie Hahn of Vanes, Florida explains why poor circulation can cause some serious problems for your legs.
If you'd like to take another look, share a story you've already seen, or want to check out any of the more than 2,000 past stories in our video archives, visit us at youtube.com/hometownhealth on your computer or mobile device.
You're watching the multi-award-winning Hometown Health. Good things for those who wait. We'll be right back.
The content and information provided by Hometown Health is intended for informational, educational, and entertainment purposes only. Always be sure to consult with your physician or other medical professional to determine what's best for you and your health.
Welcome back to the February Heart Health episode of Hometown Health, serving Lake County and the Villages since 2009. I'm Mark Roberts.
And I'm Beverly Onstead in studio at Lake Sumter State College. We spent the last segment driving home the importance of heart health. Poor circulation can cause many health problems, but good health habits can counteract them. Another reason to promote healthy activity is to prevent blood clots, a gel-like mass that forms to repair damage to a blood vessel. But they can cause harm as well. Clots can obstruct blood flow, resulting in poor circulation, and if they become dislodged, they can travel to other parts of the body, causing bigger problems. Dr. Charlie Hahn of Veins, Florida tells us the signs to look for.
Usually you tend to notice the leg feel heavy, and there's a lot of swelling. And sometimes patient can have fatigue, and that can be caused by the blood clots that are traveling from the leg to the lungs, and which is, happened to Williams, the famous tennis player. She developed blood clots in the leg, which she didn't know. I think she had lots of fatigue and shortness of breath. That's how they find out she has blood clots. They tend to develop blood clots because there's less blood flow. When you sit in for a long time, you kink off those veins in the pelvis, and then the muscle doesn't move as much, so it doesn't pump the blood back into your system. But they tend to develop blood clots, and they do not tend to develop varicose veins. I would suggest they can take some aspirin as prophylaxis if you're medically able, and also try to get up and move around. As long as you move around, the leg muscle, they're pumping, and they will sort of like acting a muscle pump, and they pump the blood and back and forth, and that will decrease the chance of blood clots. Ablation process means we destroy the vein that has developed problem. We can use different energy source, most popular laser, and also microwave. And these are minimal invasive. We place the device into the vein, which is usually the saphenous vein. They have leakage of the valve that causes those varicose veins. And when inside the vein, the device will heat up. It's either by microwave or by laser, and then will damage the lining of the varicose veins, and then will make it shrink and eventually go away. We prevent the blood flow, excessive blood flow, from coming back and reach those varicose veins. The blood flow used to be back up in the vein would now be rerouted to the deeper vein, which will be back to the system. With ultrasound guidance, it's usually only about the 1 needle incision, and it has minimal blood loss and really minimal pain and post-operative recovery time. The stripping of the saphenous vein is on its way out. Not a lot of people do it because it's such a traumatic experience, and the patient can bleed a lot. For our new ablation procedure, even for microphlebectomy, it takes really minimal sedation. It takes a very short period of time to do, usually about 30 minutes, 40 minutes. Patient go home same day, 30 minutes, an hour after surgery. Really not much pain after surgery, and all the incisions are very small, very minuscule, and heal very nicely. And it can eliminate almost all those unsightly veins and swelling and pain patient experience. So I think it does really help patients a lot. From the procedure and the post-op recovery, and also amount of pain they experience during the procedure, after procedure. It is really much dramatic improvement.
If you'd like more information on this story or contact information for Veins Florida, just click on the Stand Up to Clot story link icon on our homepage at yourhometownhealth.com.
A key factor in our heart health is keeping our blood flowing freely. We know one of the dangers associated with it is cholesterol, but for all the bad press cholesterol gets, it actually provides an important function to our body. Cholesterol is both friend and foe. The Center for Disease Control and Prevention defines cholesterol as a waxy, fat-like substance that's a building block for the hormones progesterone, testosterone, and estrogen. It's also vital in digestion of fats and production of vitamin D. In proper amounts, it's essential for the body's functions. Cholesterol travels through the bloodstream in packages known as lipoproteins. The good kind, high-density lipoproteins, can remove cholesterol from the arteries, while low-density lipoproteins, the bad kind, is the kind that collects in the tissues. When there's too much of the bad and not enough of the good, the game changes. Excessive cholesterol clogs the arteries, creating double the risk of heart disease as those with proper levels. One noteworthy consequence of cholesterol buildup is coronary artery disease, where the collected cholesterol causes inflammation in the artery, which could lead to a heart attack. Currently, only 1 out of 3 adults with excessive cholesterol have the condition managed, with less than half of those affected even seeking treatment. But unhealthy levels of cholesterol can be reversed by reducing carb and sugar intake, exercising, and refraining from smoking. You'll find a link to information on cholesterol count when you click the News of Note tab on our homepage, yourhometownhealth.com.
Is your outlook on things looking dim? If so, you may have a vision impairment. February is Low Vision Awareness Month. The Glaucoma Research Foundation reports that 4.2 million Americans are vision impaired. There are many causes for impaired vision, one of which is droopy eyelids. Eyelid drooping or ptosis is caused by the levator muscle in the face stretching and loosening, no longer lifting the eyelid, which can impair or totally block vision. If the world looks to your eyes like the shades are drawn, Dr. Dino Madonna of Lake Ear, Nose, Throat and Facial Plastic Surgery shares a possible solution to the problem.
Quite often, again, that's another one that has a gamut, upper eyelids and brows to some degree, where you can't see. I mean, it affects your peripheral vision. I mean, I've had people who are pilots that, say I come in for landing, I find myself having a difficult time kind of have the whole, visual field in front of me. So that's important. And, basically at that point, you do need certain testing to kind of verify that it is affecting their visual fields. And the idea is to go ahead and pull up the brows to a more natural position. And once you've pulled the brow up, now you can adjust the eyelids and take the excess skin off. You can't sew your eyebrow to your eyelid, but you have to raise the brow up first to where it belongs and then take care of the lids. That's not always the case. Sometimes it is just the eyelids. But when the skin is hanging low and you can't see, we can take care of that. Our primary goal is good, ethical care for the patient.
For more information on this story, as well as the links to the specialists at Lake Ear, Nose, Throat and Facial Plastic Surgery, please click on the Real Eye Opener story link on our homepage at yourhometownhealth.com. Here's an eye-opener. Florida's recent vote to legalize medical marijuana has caused some analysts to look at the social ramifications of that move. Contrary to popular belief, marijuana may not be a gateway drug. Instead, some researchers are calling it an exit drug. Per the Journal of Addiction Research and Theory, medicinal marijuana is being used as a substitute for harder and more dangerous drugs. More than 400 users of medicinal marijuana were surveyed, asking how their substance abuse habits had changed since using medicinal marijuana. 41% of those surveyed said they use medical marijuana rather than alcohol. 36% stated they use marijuana instead of illegal drugs, and 68% confirmed they use marijuana rather than abusing prescription drugs. Those who choose to use medical marijuana over other substances stated they suffered from fewer side effects, less withdrawal symptoms, and experienced better symptom management than with illicit or prescription drugs. With these findings, the researchers hope this increasing substitution can cause an overall decline of substance abuse. You'll find a link to information on the medical marijuana myth when you click the News of Note tab on our homepage, yourhometownhealth.com.
Looking for even more health and wellness information? Check out Waterman Wellness, airing exclusively on Lake Sumter TV. With a look at this month's episode, here's host Alyssa Horitzik. Alyssa?
Thanks, Mark. You'll want to tune in to this month's episode of Waterman Wellness because local cancer patients can now receive advanced treatment from state-of-the-art technology now available at a Lake County Cancer Center. In our Focus on February Heart Month, you'll find out how a local heart team prepares every day for bypass surgery, a practice that this man is thankful for. Plus, what is causing your child's cough? You'll want to tune in to hear what our local expert has to say. You can watch Waterman Wellness exclusively on Lake Sumter TV. Visit our website, lakesumtertv.com, to check our program schedule. Back to you, Mark.
Thanks so much, Alyssa.
And with that, we head to our next break. But when we come back, it's Cancer Prevention Month, and Florida Hospital Waterman has the guidelines to keep the dreaded disease at bay.
Plus, even though it's the winter months, the sun is still shining strong. We'll have some tips to handle the Sunshine State's constant companion.
Also, the dead of winter is the prime of cold season, but do you get one at the same time every year? It may not be what you think.
Just a quick reminder to stay up to date with Hometown Health through our Facebook page. Events, photos, seminars, and interesting stories are just a like away, so join our followers.
You're watching Season 8 of the multi-award winning Hometown Health, serving Lake County and the Villages. We'll be right back.
The content and information provided by Hometown Health is intended for informational, educational, and entertainment purposes only. Always be sure to consult with your physician or other medical professional to determine what's best for you and your health.
Welcome back to Hometown Health. Good things for those who wait. I'm Beverly Onstead.
And I'm Mark Roberts. It might be the dead of winter, but the sun's rays are still shining, which means we are susceptible to sun damage all year long. Sun damage isn't the same for everyone. Jessica Folgore-Arnold of Alani Medical Spa shares the different ways it can present itself and what can be done to repair it.
Sun damage can be can come out in different ways on different people. You can have very deep lines and wrinkles. You can have very dry skin from sun damage. You can also have pigmentation from sun damage. It does age you a lot. You can have sun damage and only be in your 30s but look like you're in your 40s. And that's something that's very important for clients to feel. Not just, they don't want to look necessarily in their 20s when they're in their 40s, but they do want to look good for their age. Having SPF in your daily products that you use is very important. You want to make sure that the SPF is over a 35. You want to make sure that the SPF is reapplied every 2 hours. You want to make sure that you're applying it, but you're also using it in your makeup, in your chapstick, in your lipstick. You want to make sure that not just what you put on your body is being reapplied, but also what goes to your face, which a lot of clients fail to remember. We also have chemical peels, and you can go just into products. Abaji is a wonderful way to help with sun-damaged skin. It's something more that the client can do at home versus having to have these procedures with some downtime. There are different ways that you can treat sun damage. We can do laser procedures. You can have a chemical exfoliation along with Abaji, which is a wonderful way to treat sun damage, and that can be your pre, during, and post care. The most important thing to look for when you're wanting to have a treatment done, especially treatments that go more in depth, is you want to make sure that any place that you go has a physician on staff first and foremost. You want to make sure that you're meeting with somebody that has the educational background to be able to take care of you and treat you without damaging anything or making anything worse. Second, you want to make sure that you walk into a place that has an atmosphere that you feel comfortable with. You don't want to walk in and still be nervous. You're going to be scared for your treatment. We want you to feel relaxed. Our clients here at Alani feel like they walk into a place that they can relax. They can feel at home. You don't want to feel like it's cold and very medical. That's the thing when you walk into Alani, is you feel like you're walking into a beautiful facility. You don't feel like you're about to have a medical treatment.
For more information on the products and services available at Alani Medical Spa, please click the Sunny Disposition Story Link icon on our homepage, yourhometownhealth.com.
Don't be fooled by our warmer than usual winters. Regardless of the temperature here in the Sunshine State, we can't escape winter colds. But if you catch a cold like clockwork the same time every year, it may not be a cold. Ed Newsel, board-certified nurse practitioner at Allergy, Sinus, and Asthma Family Health Center, explains.
The difference between cold and allergy symptoms are very difficult because they share many of the same symptoms. You can get a runny nose, stuffiness, pressure, headaches. The thing that you won't get with allergies is a fever. In a viral condition or in a bacterial condition, fever may be present. And the other thing, when people say, oh, I get a cold all the time this time of year, generally is an allergic response, because there's no reason why in the spring you should always end up with a cold. So you want to look at, am I having this all the time? Is it something that only happens at a certain time? Do I have a fever? Another thing with allergies is that you can get itching. An itchy nose is not a viral condition, especially if all the drainage is all clear, your nose itches, stuff's running down the back of your throat, you're clearing your throat a lot. Those can be just due to allergies. Now the treatments sometimes can be similar, but in allergies you can use an over-the-counter antihistamine to help. I don't really recommend a lot of decongestants, although it does help in drying up some of the drainage. It's just that as we look at decongestants, and one of the things that in this particular area where we have people that are a little bit on the older side, decongestants work by shrinking the blood vessels. And I don't know about a lot of people around here, but I'm at the age I don't want to be shrinking no blood vessels. So either in the brain, in the heart, in males, it can cause inability to sleep at night, so there's insomnia, can increase heart rate, increase blood pressure. So we really want to go ahead and be judicious in our use of the over-the-counter medications, and I tell people that if they do want to use them, discuss it with their pharmacist so they can help direct them in the right way. A lot of interactions with decongestants can be the high blood pressure. And like I said, when we go ahead and shrink blood vessels and increase heart rate, shrink blood vessels, that's not a good thing to do. We expect the general public to know more about medications and health conditions than what I think is correct. When using over-the-counter medications, I think getting the consult from your pharmacist is very prudent because they can help direct you based upon what your allergies are, what your other medications are, so you choose the appropriate medication. And whenever in doubt, go to your provider so that they can give you a better direction based upon your condition.
To get in touch with Ed Musil and the staff at the Allergy, Sinus, and Asthma Family Health Center, please visit our specialist directory. Just click on the Clockwork Cold tab on our homepage, yourhometownhealth.com.
Our next news of note turns our attention to the north, where Canadian researchers have discovered a new road to some causes for dementia. The Lancet Medical Journal reports that Ontario-based public health organizations have detected a connection to living near busy highways and dwindling cognitive function. While dementia is usually linked to age, family history, and genetics, the Canadian researchers followed a total of 6.6 million Ontarians aged between 20 and 85 for over a decade between 2001 and 2012. 95% of the participants in the study lived within 1 kilometer of a major road. Over the 10-year period, the researchers identified more than 240,000 cases of dementia. The risk decreased the farther away people lived from the main road. The results suggest that the risk of dementia was 7% higher for those living within 50 meters of a major roadway. This dropped to 4% for those living within 500 to 100 meters, 2% for those living 100 to 200 meters, and there was no increase in risk for those living more than 200 meters away. By the way, if you're struggling with those metrics, 50 meters equals about 150 feet. It's speculated that long-term exposure to traffic pollutants, in particular nitrogen dioxide, has a degenerative effect on the mind. You'll find a link to information on Road to Dementia when you click the News of Note tab on our homepage at yourhometownhealth.com.
February is National Cancer Prevention Month. The American Institute for Cancer Research estimates that 1/3 of cancer cases could be prevented by practicing healthy habits. An estimated 374,000 cases of cancer could be eliminated through lifestyle choices: avoiding tobacco, healthy helpings of fruit and vegetables, being physically active, never skimping on sunscreen, and getting immunizations along with regular medical exams all can count towards reducing your cancer risk. The specialists at Florida Hospital Waterman's Digital Mammography Center guide us through the many factors that can lead to breast cancer and how to stack the deck in your favor.
The etiology of breast cancer is confusing. In scientific terms, they call it multifactorial. There's a lot of things that can lead to development of cancer in the breast or elsewhere in the body. For breast cancer, we know there's a strong genetic history. There are genes that are markers for breast cancer and family histories that lead people to get cancer for other reasons. Other things have been suspected. Certain diets have been implicated with breast cancer. In terms of preventing breast cancer, to a certain extent, you have a hand that you're dealt, and what you can do to help improve your odds is, in general, live a healthy life and have a good diet, but also do self-exams and follow routine screening protocols. That way, if anything should happen, we catch it as soon as possible and give you the best chance to survive. The way we do mammography at Florida Hospital Waterman is most women schedule for screening mammograms. That means it's time for their routine yearly or biannual exam. So they come in, they have their examination by the technologist. That examination is reviewed by a radiologist, and an interpretation is given. And depending on the interpretation, the patient may need additional images. If they need extra pictures, we call them back and we schedule them for what's called a diagnostic mammogram. At that point, they have more pictures taken by the technologist, including compression views or magnification views, depending on what their breast issue is. Then those films are reviewed by the radiologist at the time, and then we talk to the woman and let her know what's going on and what our recommendations are. Also, at that point, if the woman needs a breast ultrasound, we do the breast ultrasound right here in the department and discuss the results of the ultrasound as well. There's a lot of information on a screening mammogram. Sometimes a screening mammogram is not enough to decide what's going on, and we have to call the patients back for what's called a diagnostic mammogram. A diagnostic mammogram is additional views of the breast, some of which may be magnified or compressed in a different way. Depending on what the results of that diagnostic mammogram is, we can decide what course the patient may have. The majority of the women go on to routine screening afterwards. You don't need to have any kind of procedure done. Some women, after the diagnostic mammogram, need to have an additional test, such as an ultrasound, which we can do in the department right then and there. If the woman should need a biopsy after all these tests are done, we call her physician, try and schedule it for her at that time, explain to her what the procedure is and how it will be done, and get everything set up before she leaves so she knows what's going to happen.
Florida Hospital Waterman has been designated a breast imaging center of excellence by the American College of Radiology. If you'd like more information about their digital mammography services or to schedule an appointment, follow the Curb Cancer Story link on our homepage at yourhometownhealth.com.
And with that, it's time for another break. But when we come back, it's February, so that means those January gym memberships are beginning to taper off. But we'll show you a place dedicated to keeping its members active all year round.
Plus, for every ethnicity, there are some unique health risks that go with the territory. Advanced Gastroenterology and Surgery Associates tell you how to handle them.
And it's one of the most widespread health maladies in the world, and there's currently no cure. Audiology specialists at Lake ENT advise how to manage it.
Join us all this month for the multi-award-winning Hometown Health and medical offices throughout Lake County and the Villages, and on Lake Sumter Television. You'll find LSTV on Comcast, Bright House Spectrum, and CenturyLink Prism. We'll be right back.
The content and information provided by Hometown Health is intended for informational, educational, and entertainment purposes only. Always be sure to consult with your physician or other medical professional to determine what's best for you and your health.
Welcome back to Season 8 of the multi-award-winning Hometown Health, Good Things for Those Who Wait. In studio at Lake Sumter State College, I'm Beverly Onstead.
And I'm Mark Roberts. Each ethnicity has its own unique health risks, with certain conditions affecting certain ethnicities at a higher frequency than others. The National Library of Medicine reports that African Americans, in general, are more likely to be diagnosed with esophageal cancer, twice as likely as other ethnicities. With this vulnerability in mind, it's wise to take precautions to keep your health in check. Dr. Tree Hun of Advanced Gastroenterology and Surgery Associates tells us how to detect esophageal cancer and the importance of doing it at the first signs of discomfort.
There are different ways of doing it. We can do it with Sévère dilation, which is a plastic tube. You can actually dilate. It's quite long, and it has a taper end, so you will insert the tube into the patient's mouth with a guide wire. So that is one option. The second option is the balloon. So you do have a catheter. You put the catheter through the scope, and you will inflate the balloon right at the stricture site, and that will stretch the esophagus. So depending on your expertise and your comfort level, and we are trained to do that, but some prefer to do the Sévère dilation, some prefer the balloon dilation. For gastroenterology practice, you see a lot of patients come with acid reflux, and also you see patients with irritable bowel syndrome, abdominal pain, diarrhea, constipation. So those are the typical symptoms that patient would come in for you to address.
I had acid reflux, and I have a large hiatal hernia, and the doctor did an endoscope and discovered I had some problems and gave me some medication in order to deal with it. And after a given amount of time, I came back on his direction, and he did it again. It proved to be an improvement, so I haven't had reflux since he's worked on me.
Barrett's esophagus is a complication related to acid reflux. Distal junction of the esophagus being exposed to the acid, and the lining of the esophagus the cell lining the esophagus change into a different kind of cells. They call it columnar junction. So this is a disease problem, and it can progress to esophageal cancer. It is difficult because a lot of these patients, they come in, and with our food is so available nowadays, it is difficult recommending them how to follow the guidelines, but you try to talk to them as best as you can. And usually some of the food items that need to stay away from, like coffee, tea, caffeine beverages, tomato sauce, garlic, minty gum, chocolate, spicy food, anything that is fatty meals, then you need to stay away from that. With GI practice, you do have a lot of patients come in with difficulty swallowing, so it is one of the warning signs, especially for Caucasians, male older than 55 years old. If they have a long history of smoking, drinking alcohol, you want to make sure that they have no esophageal cancer. So the first thing to do is to do the endoscopy. It takes about 5-10 minutes to have the procedure done. And some of the patients, they just might simply have a manifestation from acid reflux. So with acid coming back into the esophagus, that can cause stricture of the esophagus, and they can have difficulty swallowing solid food. So during the process of doing the procedure, I will stretch the esophagus, and a lot of times that will help the patient with swallowing. A good day for me is when a patient come in and they're telling me that they have a positive response to any treatment that I have. If they come in complaining of acid reflux, and with my treatment they don't have that problem anymore, or they come in with difficulty swallowing, now they're able to eat, swallow, even eating steak. So that is a positive feedback for me, and that's just a motivation for me to even try harder to take care of patients.
For more information on Advanced Gastroenterology and Surgery Associates and their services, please click the Ethnic Connection StoryLink icon on our homepage at yourhometownhealth.com.
If you're a woman who likes to procrastinate, we have some good news for you. The Boston University School of Medicine is finding that women who choose to have a child after the age of 33 are exhibiting double the chance of living to 95 or older than women who have their last child before age 30. What this demonstrates is women who are able to conceive children later in life have a slower aging reproductive system, and in turn, a more slowly aging body. The findings also indicate that women may be the driving force behind the evolution of genetic variants that slow aging and decrease risk for age-related genes, which help people live to extreme old age. This may also possibly answer the question as to why women, on average, live longer than men. You'll find a link to information on ladies living longer when you click the News and Note tab on our homepage, yourhometownhealth.com.
With January behind us, those New Year's Get Fit resolutions are breaking down. As a matter of fact, 80% of those Get Fit resolutions don't exist after 5 months. Data from the International Health, Racquet, and Sports Club Association reports that 44% of gym goers terminate their membership due to cost. Other reasons cited are inconvenient location of the gym, not using the facility often enough to justify the membership, or having other fitness alternatives. We spoke with one Waterman Village resident who tells us how he keeps active and involved in his community. No gym membership required.
I've always been very active. I played tennis, I played racquetball, I played pickleball, I golf. I do all those things. I want to continue to do them as long as I can. And here in Waterman, there's more activities than I can do. I mean, I have to pick and choose, you know. But I do play golf, and I haven't gotten into the pickleball yet, but I'm looking forward to that because we do have an option to go down to Mount Dora and play with their club. I go to the gym probably 3 times a week. I have a workout routine I do. They have 2 personal trainers in there, which would set up a program for you. But I've been working out most of my life as a part of my, trying to stay healthy. So I have my own routine, but my wife also goes there, and she has a set routine with the personal trainer. And the gym is a very nice, very functional gym. Michelle is there full-time, and she has a part-time trainer. Her name is Heather, but Michelle is there all the time, and she's very, very knowledgeable about all the latest techniques and things like that. She does a great job. You have to think about the future, and what are you going to do with your life as you get older and older. And this, to me, was an entirely new concept. I've been brought up that we own our own home, and as long as we can, till we get our home paid off and everything. And that was always what I thought about. But when I came to Waterman and I looked at this and I talked to the salespeople and everything, it's a new concept, and I think it's great. I think they should have more and more of these types of facilities. It is worry-free living. We don't have to worry about the house anymore. We don't have to worry about the doctors or whatever. This is all taken care of for us, and I think it's great.
To find out more about Waterman Village in Mount Dora or their personal training services, please click on the Active Every Moment story link on our homepage at yourhometownhealth.com.
February is host to Tinnitus Awareness Week from February the 6th to February the 12th this year. Tinnitus is commonly referred to as ringing in the ears. Tinnitus affects nearly 45 million people in the United States, and of those, 20 million have chronic tinnitus. It is most commonly caused by exposure to loud noise and is one of the most widespread health maladies in the world. Mindy Pollitt of Lake ENT's audiology team sounds off on the facts of the condition.
Tinnitus is usually in correlation to nerve damage, so we can't fix the nerve, so we can't make it go away. But there are ways to mask it with hearing aids so it's not as dominant for you. Those are the types of things. But we need to see, is it from nerve damage, or it could be medicine related, that type of thing. So it's an indication to get a hearing test so you can see what's going on. Tinnitus can be described as ringing, roaring, crickets, bees, any types of noises. You'd be surprised how many people describe it different ways. So it can be just any type of noise that you hear in the ears. You can hear it in one ear versus the other, or sometimes it just sounds centrally located like it's just in your head. If you have a sudden impact loss like that, you can have the ringing or the roaring or high-pitched noises, and then as that recovers, it will go away. If it's from, true nerve damage, it's pretty much going to be there all the time. Some people just don't notice it as much as others. Tinnitus can develop over time, and not everybody that has nerve damage has tinnitus. It's just, luck of the draw. Some people have it, some people don't. There are 3 types of hearing loss. There's nerve damage, which is called sensory neural hearing loss, and that's just where the little hair cells in your inner ear or the nerve is damaged. So there's nothing that can be done to fix that. We can aid it with a hearing aid, but we can't fix it. There's conductive hearing loss, which is something medically is going on in the middle ear that's not letting the signal pass through to get to the hearing nerve. So sometimes that can be treated medically, whether it's fluid or infection, or even if the bones of the middle ear are not working, there's surgeries that can be done to fix that. And then the 3rd type is called mixed loss, and it just means that it's a mix of both the nerve damage and the conductive. So there's a component of that loss that might be fixed medically, but you're still going to have some hearing loss from the nerve damage.
Tinnitus currently has no cure, but there are treatments to make the condition more manageable. For more information on this story, as well as links to the audiology specialists at Lake Ear, Nose, Throat, and Facial Plastic Surgery, please click on It Rings a Bell story link on our homepage at yourhometownhealth.com.
Think what you want, but it's no accident. It is time now for some newsworthy numbers. $31 million. That's the reported number of yearly injuries from accidents around the house. Some of those injuries can be avoided by installing more pliable floor materials like cork to soften a fall, or using textured tile to prevent a slip in the bathroom.
36th place. It used to be 33rd. Florida has slipped 3 slots since last year in the ranking of healthy states. Our strengths are scant air pollution and low rates of cardiovascular deaths and whooping cough. It loses ground with high rates of people living in poverty and without health insurance.
11,000. That's the number of children on average that are conceived on Valentine's Day. So be on the lookout for a lot of November birthdays. And on that note, we bring this month's episode to a close. Thanks so much for joining us.
And as always, thanks to all the Lake County specialists who make up the Hometown Health Network.
We'll see you back here again in March as we kick off Season 9 of the multi-award winning Hometown Health. Until then, here's wishing you good health and good things for those who wait.
The content and information provided by Hometown Health is intended for informational, educational, and entertainment purposes only. Always be sure to consult with your physician or other medical professional to determine what's best for you and your health.